Good morning, everyone. We're going to listen to a very interesting information about traffic safety. It is something that we don't hear too much about in San Miguel. They don't say much about it. They don't write much about it. But I can unfortunately tell you that we do have quite a number of traffic accidents. And Mexico, as such, is very high on the list of countries with many accidents. But we are lucky today that we are getting probably the most knowledgeable person about this subject area to talk to us today. Arturo Cervantes is a professor at the Anáhuac University in Mexico City, but he has been engaged in an awful lot of different things. He is a doctor. We heard that before, those of us who came to the meeting early. And I got to know Arturo when he was in charge of the safety group in the health ministry. It is very interesting that accidents is a health matter. It is not really what we would call a traffic accident matter. It's a health matter. So it's dealt with by the Ministry of Health. That is very unusual in Europe, where I come from. It is all in the transport ministry. They deal with health as part of what happens, one of the consequences of traffic. Nowadays, there are other consequences like environmental issues, which is also taken into account in many countries, not in all, but in many countries. But we are very happy that we can welcome Arturo Cervantes to us. I want you all to help me welcoming Arturo for an interesting presentation. Thank you for coming, Arturo. Very welcome to our club.
Thank you, Ivar. Thank you for the introduction, and thank you to the Rotary San Miguel de Allende Midday Club for inviting me to be a speaker. I'm wondering if you can all see my screen.
Yes, it's very clear.
Perfect. So I understand that I have like 30 minutes at most. Is that correct?
Also correct.
Okay. So thank you, and it's a pleasure to be here to speak with you and to share with you some thoughts. As Ivar was explaining, I am Arturo Cervantes, and that's me in a picture. I have a NGO, a non-government organization called the National Alliance for Road Safety. We founded it in 2015, and I'm going to be sharing with you from this ANASEBI group, part of the work that we've been doing and the road ahead. And I also wanted to share this picture. Some of you might know this person who is past president of the Rotary International Group. And this is a good friend of mine who recently passed away, Frank Devlin Mortensen. And he's a very proud Rotarian, and he had me involved in many activities in the clubs in Mexico. So I'm honored to be speaking to this Rotary group in San Miguel de Allende. And I will be speaking about road safety in Mexico. I will be sharing some thoughts regarding the reality, the costs that road safety has for the country, as well as some of the challenges and opportunities that we are facing. And I will try to gear some thoughts towards the San Miguel area where your community resides. And so my talk will have three parts. I will share some background information, some of the results that have been obtained lately in terms of road safety, and some of my thoughts regarding the way forward for the coming decade or so, and hopefully inspire you to have this topic as part of the Rotarian strategies and topics of interest. So to go to the point, road safety in Mexico. I have been to San Miguel. I have a lot of good friends there, and the traffic situation is just unbearable. It's crazy how such a beautiful town is full of cars. The works that are going on to improve the city are just causing traffic problems, tremendous traffic problems, but not only congestion of our avenues, but people are dying. People who are riding their bikes are dying on the streets every day. Pedestrians are dying. Las carreteras, or the roads leading into San Miguel de Allende, are constantly full of accidents that are killing a lot of people. And this shouldn't be happening. If we go to Denmark, where Ivar Shakte is from, the road traffic fatality index is exponentially lower than in countries such as Mexico or in towns as Guanajuato and San Miguel de Allende. Specifically, we're seeing a lot of dead and injured people from motorcycle accidents. The motorcycle vehicle number has been growing steadily throughout the country, especially in small towns, especially for poorer families that use it as a mode of daily transportation or as a mode of living and don't have the appropriate precautions. So deaths in motorcycles are increasing at an alarming rate throughout the country. And more people are using it as a means of transportation, as a taxi. And this is bringing a lot of problem. One of the things that is related to road traffic accidents is alcohol, drink, and driving. And we have in Mexico a huge problem with underage drinking and driving. And this is also related to problems with road traffic deaths and injuries, alcohol being served to young kids. And we have a lot of dead kids that are coming out of bars on weekends and in late hours of the night. And this has become a public health problem of tremendous dimensions for the country. We have more than 4 million road traffic accidents a year in Mexico, and this has been estimated to cause a lot of poverty and a lot of catastrophic health expenses. Some people from the World Bank, the IDB, the OECD countries estimate that in Latin America, 2% of GDP is lost every year because of road traffic accidents and road traffic injuries. And this is a huge amount of money. At risk, especially are young children that are traveling unprotected in cars, that are traveling unprotected in motorcycles. And this is why I've been working on this issue. Just keep in mind that every day in Mexico, 58 people die from a road traffic accident. This is a tremendous number, but that's like the top of the pyramid, the top of the iceberg. Every day there's more than 1,000 accidents that are officially reported. We estimate that every day more than 14,000 accidents, road traffic accidents, occur throughout the country. And every day we have more than 2,000 people hospitalized because of a road traffic injury in the country. And this is a huge problem because of these people. Every day, more than 110 people are gonna result with a permanent disability due to road traffic injuries. And this causes huge problems for their families, for their communities, and for society as a whole. That is why in 2004, the World Health Organization declared that this pandemic is no accident. Road safety is something that you can prevent. And thus, in Mexico, I had the honor to start leading in the year 2007 the effort from the Ministry of Public Health. This is a picture from the first ministerial meeting of the Americas regarding violence prevention and injury prevention. And we got together with all countries in Latin America to state that this was a tremendous public health problem and that it could be prevented with science-based interventions and using knowledge and the best practices that have been implemented throughout Europe and North America. One of the first things we did was this book that had all these stories, the rostros, the faces of the victims and their families, and how much suffering comes alongside a road traffic accident. There is the website where you can download the book and learn about some of these tragedies and stories from family members. And this is a timbre postal regarding the risk factors for road safety. We published this in 2009, and the Mexican government began an incredible effort regarding distracted driving, regarding the use of seatbelts, regarding respecting pedestrian walkthroughs, respecting signs and speed limits, not using your cell phone, taking care of your children while in cars. This seems to be a behavior that is very much taken as a given throughout the United States and throughout Canada and European OECD countries. But in Mexico, that was not the case in 2007 when I took over. And I just want to share with you this video from, I hope you can hear the sound from the head of the United Nations that spotlights this problem, no? Let me see if I can go back and put this short video. $1.3 million people die every year. This was the first global ministerial conference in road safety, which was held in Moscow in the year 2009. And the latest one was in Stockholm in February, the third ministerial conference. And in Moscow, we decided to call for the Decade of Action for Road Safety from 2011 through 2020. We came together throughout the world under this logo with the slogan, "Together we can save millions of lives." 1.3 million people lose their life every year in the world's roads, and this is a preventable public health problem. We worked hard and we got the Senate of the Mexican Republic to declare the Decade of Action for Road Safety in Mexico 2011-2020. And we even accomplished that the president at that time signed into the law the National Strategy for Road Safety. Remember, this is 10 years ago. This is on May of 2011. And together with the Minister of Health there on the left and the Minister of Transportation there on the right, the President that as witnessed, the National Strategy for Road Safety was signed into law and was published at the official diary of the Mexican Federation. And basically this strategy was aligned to the global plan for the Decade of Action for Road Safety of the United Nations, because we know how to prevent these deaths. This is a public health epidemic that is preventable, fully preventable. More than 90% of these deaths are avoidable deaths and unnecessary deaths if we would just follow the evidence. Even Grover joined us from Sesame Street in order to bring awareness for children regarding this public health emergency and epidemic in Mexico. The goals that we set forth for the country for the decade of action was to save an estimated 60,000 lives and to avoid an estimated 110,000 disabilities. The goal was to reduce in half the number of fatalities, the number of injuries, and the number of disabilities from road traffic injuries. And basically, if no action was taken, the number of deaths would continue to rise. And if we followed the global plan, we would reduce 50% the number of deaths in Mexico throughout the country. So this is the background, no? And we try to put these things into law, and we try to garner the political will. And now I will share with you some of the results of this program. Was Mexico able to reduce in half the number of deaths and disabilities and injuries? And even considering that the number of vehicles is growing at an alarming rate. In the year 1980, we had 5.7 million vehicles in the country. In the year 2000, we had 15.6 million vehicles. Today, we have over 50 million vehicles. And of these, more than 5 million vehicles are motorcycles throughout the country. And this number keeps growing. But what happened to the deaths? Well, Mexico did not reduce the average 18,000 people who die every year in road safety. Here I'm putting the 10 years of the decade of action for road safety. And you can see that in terms of number of dead people every year, we remain at a stable over 18,000 deaths every year, officially registered deaths. This means that there have been only in this century, in the first 20 years, more than 327,000 deaths in Mexico. This is an average of 43 deaths per day, every day, between 2000 and 2019. And unfortunately, this means that if things remain as are, status quo, we will have more than 85,000 deaths over the coming 4 years. How many are acceptable? Well, Sweden has a zero goal, zero road safety deaths. You can have 3 or 4 years in some European countries and nobody gets killed, especially no children or no pedestrians get killed, because they follow the rules and they follow the law. So it is very alarming. For example, those are the death rates in motorcycle riders in Mexico. We used to have 1 death every 2 or 3 days, and now we have more than 10 motorcyclists dying every day in Mexico. And remember, a death is just the tip of the iceberg, because below that tip of the iceberg, there's thousands of injuries and hospitalizations. So it's not only dead people we should be worrying about, but also those who become injured. One of the problems in Mexico is that we don't have accurate sources of information. What you can see in this graph is in green how many people the Ministry of Health reports as dying every year. In red, you have how many people INEGI thinks that are dying or reports that are dying every year. In blue, you have the transportation authorities, how many people they say that are dying every year. And in light blue, you have the Ministry of Public Security, la Secretaría de Seguridad Ciudadana. So we don't even have the information systems that allow us to measure this public health problem. And if we don't measure something, we cannot improve it. We cannot tend to it. So that's a major problem. One of the alarming things in Mexico, if you work with the Association of Insurance Agencies, you will find that on average, 12% of all insured vehicles crash at a given year. This is much higher. Almost a third of microbuses or a third of urban transportation vehicles crash on any given year. And this graph shows you that specifically public transportation, which is used by the poorest or more vulnerable populations, are at a much higher risk of causing a car accident and crashing. And this is something that should be taken into consideration because of the following. The Institute for Health Metrics and Evaluation, which corrects mortality data, estimates that in 2019, Mexico had more than 21,000 mortal victims. And this is about because of the sub-registration that occurs in Mexico. But Mexican authorities report more than 91,000 injured victims coming into the hospitals this given year, 2019. We have more than 362 registered accidents in the country, but we know that more than 5 million accidents occurred last year if we use insurance data for insured vehicles. If we consider that the GDP per capita in Mexico is close to 146,000 pesos, and if we consider that the average age of death of persons in road traffic accidents is 30 years, and if we consider that the life expectancy is 75 years, every person that is killed stops living for 45 years and stops producing the GDP per capita for 45 years. So this costs an enormous amount of money. We also estimate that every year, or in that year, 2019, Mexico lost above 1.1 million years of life lost because of disabilities caused by road traffic accidents. And this is a huge burden on the financial, social, and public health system in the country. Just to estimate the cost, you need to consider that every year the victims will add more than 180,000 disability adjusted life years. That's a term that we epidemiologists use in public health. And if we consider that 145,000 pesos is the average annual cost of living with this disability in the country, and if we consider that all these hospitalizations cost around 12,000 pesos every day, those are figures from the IMSS, and that every patient spends 5 days at least in the hospital after being injured. And if you don't get to the hospital, but you need to go see a doctor to tend for your injuries, that also has an important cost, or the cost of a funeral when a person dies. When you add up all these numbers, you come to figures that are amazing. More than 140,000 million pesos are lost every year just because of the deaths. More than 6,000 million pesos are lost because of the cost of disability. More than 130,000 million pesos are lost because of the number of accidents. The victims spend more than 6,000 million pesos, and that gives hospitalizations cost close to 6,000 million pesos, and that gives us a total cost of above 280,000 million pesos, which is around 1.6% of Mexico's GDP. This is just so that you get a sense, this is more than double what Mexico is spending on all social and well-being programs aimed at youth, aimed at children, aimed at becas or scholarships for students, aimed at all older people, aimed at productive populations. This is a lot of money that Mexico is throwing away every year just tending to the costs of road traffic accidents in Mexico. Now, what happened? The Mexican road traffic strategy that we set forth in 2011 had 47 actions. What's happening is that 70% of those actions have not been implemented in Mexican communities. Few of them, less than 15%, have been fulfilled, and around 17% have a partial fulfillment. And these are the 5 pillars of the global plan for road safety. The pillar for management of road safety, for improving infrastructure for road safety, for having safer vehicles, for having safer users of the road, and for having post-crash care. And these are how many were tended to: half of 5, a half of 4, 2 of 9. So this is just so that you get a sense. So what results does Mexico have at the end of the decade of action for road safety, where our goal was to reduce by half the number of deaths, injuries, and disabilities? Mexico has flunked, unfortunately. I left the government in 2014, and from then on, the effort has waned and almost disappeared in much of the country. And there is few governments that are taking this problem seriously. So the results is that we don't have information systems that allow us to understand this phenomena well. We lack a national agency for road safety. We lack road safety audits in infrastructure and in public works. So nobody is taking care of the roads being safer. We don't have a national public vehicle registry, so we don't know when a car crashes or kills someone. It's very hard to know who owns that car in order to make them responsible. There is no compulsory vehicle insurance. Of the 50 million vehicles in Mexico, around 22% are insured. This means that 78% are not insured. So if they hurt you or damage your property, nobody is going to take care of those costs, of covering those costs. There are no vehicle safety norms. So vehicles that are sold in Mexico are substandard in terms of vehicle safety. We have not standardized traffic regulations. So you have some laws in San Miguel, some in Guanajuato, some in Mexico City, some in Monterrey. So transit regulations are not standardized. Driver's license are given out. You just need to have a Coke bottle tap or a cereal cover of a box, and you go and get your license. They don't test you. They don't examine you. There is very little campaigns or social communication regarding this topic. Vulnerable road users, and I'm meaning pedestrians, children, motorcycle users, are left unprotected because the car is king, and it's pedestrians and vulnerable users that need to take care of cars and not the other way around. And we don't have a general law of road safety in the country, and that is why some of these problems persist to date. So having said that, I will conclude with some thoughts regarding the way forward. And this is basically a hopeful decade. As you know, we have Agenda 2030 and the Sustainable Development Goals. And specifically, Sustainable Development Goal number 3 has been adopted. And in the objective 3.6, we are aiming to reduce in half by 2030 the number of dead people and injured people in the roads. And in objective 11, we are looking at sustainable cities and communities, which means that sustainable mobility and road safety is a must. And we need strong institutions in Sustainable Development Goal 16. We need strong institutions that are able to withhold the law and to pass appropriate regulations. So I'm hopeful for the world and for Mexico because Agenda 2030 has specific goals regarding improving road safety. And recently, as you see, this is a September 2020, the United Nations has called for the second decade of action for road safety. So from 2021 to 2030, having flunked Mexico and many other countries, we have declared the second decade of action for road safety, which will start next year. And we think we have an achievable strategy and commitments across the globe to achieve substantial change on this public health emergency. So majors and diplomats and political leaders from across the world have committed to halve the road deaths and serious injury by 2030. That's 50% by 2030 reductions. And there is a second global plan to achieve it. Even in Mexico, last month, the deputies have approved constitutional reforms in terms of mobility and road safety. And this is a very important point for Mexico because the mobility and road safety have been opened, have been brought to the constitutional level. So recently, this last month, given the work that ANACEBI and many other civil society organizations, sustainable mobility and road safety are protected under the Mexican Constitution. And to date, 21 states throughout the country have approved this constitutional modification, constitutional amendment, and Mexico's right to mobility amendment to the Constitution is targeted to save thousands of lives in Mexico. And the discourse is changing in the country thanks to the work of civil society, academic organizations, and non-government organizations. So that is why my organization, the National Alliance for Road Safety, has existed since 2015, since I left the government. And we've been pushing for these changes throughout the country. We are working on the licensing requirements for Mexican motorcyclists, for example, so that every person who goes into a shop and buys a motorcycle needs to get a motorcycle driving course and needs to pass an examination to learn about road safety. These are some of the recent courses. And ANACEBI is civil society. ANACEBI needs the support of the Rotarian groups throughout the country to become spokespeople, outspoken against this tragic silent epidemic that is hitting us. We will continue our sustained efforts for a public road safety agenda in Mexico with a systemic and comprehensive view, with a scientific orientation, and mostly working from civil society and citizen organizations in a collaborative fashion. So thank you. This is where I work at the Faculty of Health Sciences of Anáhuac University, which is a large university in Mexico. And I am very happy as part of ANACEBI to have been invited by Ivar to share with you this conversation. Thank you very much.
Thank you very much, Arturo. Appreciate it. We have a couple of questions that have been written in on our chat box. One of the questions is, does your office consider lung health as their responsibility? In San Miguel de Allende, air quality from traffic is a major concern to a lot of us. And so they're wondering if there might be some new lung healthy buses.
Well, it would be incredible for sustainable mobility that we consider other means of transportation. Happily, in Sustainable Development Goal number 7, we have the affordable and clean energy goals for the world, and this includes transportation. Transportation is a major contributor to environmental pollution, and sustainable mobility should be clean energy mobility. Although our work doesn't specifically focus on emissions from vehicles and from transportation, This is certainly one of Agenda 2030 Sustainable Development Goals, and this is certainly interrelated with mobility and road safety. However, my group does not address this directly.
Okay, we have another question. What should we do when we see or are involved in an auto accident?
Well, first of all, you should be insured. Insurance is a critical part of the developing developing countries. You need to be insured in order to make sure that somebody is going to take care of the damage. Second of all, you must stay at the site of the accident, especially if there is an injured person or if there is infrastructure damage. You should stay there and face your responsibility. And third, I would say that all of us should be well versed in primary healthcare, in knowing what to do if somebody is hurt or wounded. You need to have a first responder training in order to be able to save a life. If you stay at the site and if you secure the site so that nobody else has another accident because of the first accident, and then if you take of the care of the injured persons and call 911, I think you will be participating in your civic duties correctly.
That is a very, very good suggestion. Arturo, I want to thank you for joining us this morning at this gathering of the Midday Club of San Miguel de Allende. It was a very, very interesting presentation, and I know that a lot of us got very, very much out of it. So once again, I want to thank you for being here today.
Thank you very much. And it was a pleasure to be with your Rotary Club. And thank you very much for the Midday Club of the Rotary District in San Miguel de Allende. And thank you to Ivar for inviting me.